everyone, my name is Linda Norito, and I'm here to inform you all of a solution which should fix the corrupt healthcare system our country has today. Most people think of this topic as a political controversy, but this is more than that. It's people's lives that the government has in their hands. With the healthcare epidemic, almost 1 in 5 Americans are going without healthcare due to high prices, problems obtaining coverage, and other things like that. I will continue to discuss these in the next slide. It includes prescriptions, eyeglasses, or other major services, and there has been a devastating growth in the number of uninsured Americans. This image to the right shows how the percentage of people under age 65 without health insurance is rising. It shows the current from 2008 to about 2016 to the projected amounts for the next 10 years or so, and as you can see, it is gradually rising right now. Reasons for living without health care. The cost is too high is the number one reason affecting 45% of Americans. Eliminating the high cost of health care will cater to almost half of the American population living without health care. Next comes they lost their job or changed employers, and that's about 22%. They lost Medicaid or status change, both 11%. The employer does not offer or they're ineligible for coverage, 9%. And believe it or not, 2% of Americans think they do not need health coverage. Some prior solutions that have been enacted, one being the Affordable Care Act. This was passed by former President Barack Obama in the year 2010, attempting to reduce the amount of Americans living without health care. It did not reduce deficit, plans canceled for over 1 million Americans, created a difficult transition to hospitals, raised deductible levels, and it led to a historic decrease in uninsured rates across the nation. The proposal I have for you guys today is a universal healthcare system. It grants medical services to every citizen at an affordable cost. It guarantees equal and quality services to citizens regardless of their ability to pay. It provides protection for citizens in terms of their health, standardizes billing procedures, and what I mean by this is doctors would be dealing with one agency instead of different private health insurers, overall creating a healthier workforce. About 32 out of 33 developed countries have this system already in place, a couple being France, Germany, and the UK. For the components of a universal healthcare system, the first thing we need to do is to propose again and expand the State Child Health Insurance Plan, or the S-CHIP, vetoed by Bush, to about 5 million children. The S-CHIP was a partnership between the federal and state governments that provides low-cost health coverage to children and families that earn too much money to qualify for Medicaid. This would cover at least 96% of children. Once every child is protected, the foundation for success is laid. Next, the effectiveness of medical services needs to start being tested. We need to get states on board because once one state abides by the universal healthcare system, others will follow suit and it would create a domino effect. The last thing we need to do is create a national health insurance clearinghouse. This would regulate how health insurance is sold and regulate health insurance prices. The national clearinghouse would be a channel for all people to get coverage. This image here shows the pathways to a universal healthcare system. It begins with a primary role calling for a substitution of the following reasons: insufficient or no government coverage, high out-of-pocket expenditure, and private or community-based insurance for some. Replace it with supplemental solutions such as optional products cover additional benefits to complement public scheme. It also shows that the government right now has no reform in place. Once we set one in place, it must change to having various government-sponsored models. For example, public or private partnerships. So for the feasibility of this solution, citizens will pay for universal healthcare system through their taxes. The use of advertisements and the media is crucial in this solution. We need to collect large pools of prepaid funds that could be used to cover the healthcare cost of those in need, regardless of their ability to pay. This image to the right shows about America and most countries in Africa do not have a free or universal healthcare system in place. Clearly, about 75% of the map is green, which means it has free and universal healthcare. We need to act now. If the percentage of uninsured Americans continues to increase, millions of our citizens' lives will be put at risk. thus corrupting children by raising them in a botched healthcare system for their whole life. It must happen immediately to save our country. We need to give citizens what they deserve. Please understand the severity and importance of the topic of healthcare. I urge you all to continue researching and spread the word among your peers. Thank you.